By the end of this episode, you're going to have peer-reviewed evidence for why kids should be laughing on purpose, walking in the woods, humming in the car, and making art as legitimate anxiety interventions. I know how that sounds, so stay with me. Welcome to the Naturopathic Pediatrics podcast. Today's episode is going to be discussing pediatric anxiety, specifically what to do when conventional options aren't enough or when families want more. Today we'll be discussing outside the box, but still evidence-based therapies for anxiety interventions in kids. So why is this an important conversation? I mentioned that in another podcast episode, and I definitely recommend going back to that one, that untreated anxiety disorders create this cycle of inflammation, and that cycle of inflammation can have downstream consequences in all sorts of areas in the body. The evidence shows that we do have some effective treatments. We'll go through those in just a minute, but access does seem to be a problem. In the UK, about 55% of adolescent children, 12 to 15-year-olds with mental health problems, receive no services at all. In Europe, it's estimated that only 26% of affected youth receive mental health services in any given year. Low and middle income countries sometimes have no services at all. And in the US, there's definitely a gap in kids and a long wait time for receiving services. And then we have a lot of kids who don't respond to treatment. Even when kids access treatment, studies say that 20 to 50% don't respond adequately at all or have contraindications to, say, medication or have medication side effects. Again, don't have access to therapies. Therapy isn't right for the child. We really do need tools that can be delivered in diverse settings by more types of providers, by families themselves, and for families that have just different types of values or need to connect with someone that meets the family where they're at, that can really deliver a type of therapy that fits the whole family and the whole person. So what does conventional medicine say? Cognitive behavioral therapy is sort of considered number one as a therapy or as an intervention for a child with anxiety disorders. Cognitive behavioral therapy is based on this idea that our thoughts, emotions, and behaviors influence each other, and that changing unhelpful thinking and behavior patterns can then reduce anxiety. One of the biggest problems that I have seen for anxiety in children is parents, well-meaning parents, thinking that it's going to help their child to just assuage their fears. So that's the hardest part about parenting is we need to teach our children to become resilient, and continuing to tell our child, it's okay, it's okay, it's okay, it's okay, or helping them avoid anxiety-producing situations actually reinforces the anxiety. It is the most challenging part in medicine that I have found is trying to teach parents and to tell parents that the only way out of an anxiety cycle is by scheduled and little bits of exposure therapy to help untangle this reinforcement of an anxious event, which leads to avoidance, which actually increases the anxiety. So cognitive behavioral therapy, again, says that all of these are tied together, that our thoughts around a stressful event affect our emotions affect our thoughts, and then our behaviors can either reinforce the anxiety or reduce the anxiety around that stressful event. So in cognitive behavioral therapy, children learn to identify anxious thoughts like something bad's going to happen. And then they learn to use their cognitive processes, that part of the thinking and analyzing part of the brain, to evaluate whether those thoughts are really accurate and then to replace them with more balanced and realistic perspectives. So in this part of cognitive behavioral therapy, it's important to have parents coach kids through these processes of, rather than avoiding the feared situations, the children gradually face them in manageable steps through little tiny exposure exercises. The way I explain this in my practice is, and I explain this directly to kids like this. Personally, I'm scared of spiders. The way that I need to desensitize myself to spiders would be something like seeing a picture of a spider, or there's actually a Lego spider in my office in my Lego bin that the kids like to torture me with by like slipping it onto my desk when I'm not looking so that I'm startled and think it's a real spider. But actually touching a Lego spider would be a great way for me to desensitize. The way to not desensitize me to spiders would be to shove a box of spiders in front of me or put a plate of spiders right in front of my face and say, hey, hold the spider. That's going to reinforce my fear that this spider is as scary. So similarly for kids who have a fear of anything, maybe fear of a social situation, we cannot have them continue to avoid the social situation. What we need to do is to train them and teach them and give them manageable, realistic steps to build confidence, to have better coping skills, to really rate their symptoms and help evaluate that. My favorite book for this is called An Anxiety Relief for Kids. It's a cognitive behavioral therapy book. The reason I really like it is it's easily accessible for parents. They can read it, but the tools are really great. What they use in this book is called the worry thermometer or their anxiety thermometer. So like 10 out of 10 anxiety would be the thermometers like overflowing. It's really nice to have that visual because it's very helpful. And I think it's almost even more effective for adults. I find that those skills are really nice for adults because they're just so easy to understand. And then, so this is just the very, very, very basics of cognitive behavioral therapy. Again, I do recommend reading that book, Anxiety Relief for Kids, and I can link it in the podcast episode notes below. But just as a just as kind of a thought around cognitive behavioral therapy, it either requires parents to be really well informed on how to do this, or it needs access to a counselor or therapist that is trained specifically in cognitive behavioral therapy. The studies show that wait times for therapists that are trained in this is like 3 to 6 months or beyond, which is hard. And then another con of this is it requires cognitive engagement. It is not appropriate for children, certainly under age 5, but even in early elementary age, it requires kids to be able to think logically, which is not something that, of course, young children are known for or have the capacity to do. There's a lot more to say about cognitive behavioral therapy. And then what's considered the next line for children would be, in conventional medicine, would be medication management, and that is typically SSRIs. It's really the mainstay of therapy for most pediatric and adolescent psychiatrists. It can reduce the physiologic intensity of anxiety. The studies do show that. And there is really some meaningful evidence for kids with pediatric anxiety disorders. But there are some risks and there are some limitations for this. One is, there are a number of parents who just don't want their kids medicated. I totally get that. A lot of parents are requesting short-term use of SSRIs for kids. And, in my experience, that's not really realistic. Most kids need it long-term. Once they're on it, it's very difficult to just do, 3 to 6 months and then wean off. The FDA did add a black box warning in 2004 that SSRIs do increase risk of suicidal ideation and behavior. In my practice, I don't have a ton of younger kids that I've initiated SSRIs on. I have initiated SSRIs on a number of adolescent patients, but I do have quite a large subset of patients in my practice that also see a psychiatrist, because I do have a number of kids with overlapping multiple behavioral and psychiatric disorders who often need a psychiatrist on board. And I have seen patients in my practice have suicidal ideation, often specific to a certain medication, and it's really difficult to figure out why. That's why for most psychiatric practices, and I strongly recommend this, they are doing weekly check-ins with patients, or sometimes more often, for those first 4 to 6, 8 weeks of treatment on an SSRI to make sure that the patient does not have suicidal ideation. And then there are side effects in some kids. They can cause agitation and restlessness, sleep disorders, for sure emotional blunting, so flattened affect, or just really feeling very flat in general. The flattening is something that my adult patients really notice and really do not appreciate. And just as another side note here, say if you are on an SSRI and you're trying to wean off of an SSRI, one of the biggest things that I have seen for my patients is they come down off of an SSRI and big traumas, big emotional events, it feels like Pandora's box opens and it can just flood out things, unresolved traumas, unresolved thoughts, feelings, emotions as they come down off of their SSRI tend to just come flooding out. And that can be very challenging. I, again, usually see this in adult patients. hard to know if that's happening in pediatric patients too, because they just often don't have the language to describe that. But that's something to be really well aware of. And then lastly, I've already mentioned this, but some families do have philosophical concerns, and I do not blame them. Most kids are on SSRIs for years. We really don't know right now what the long-term effects of that are, whether that's good or bad. As the brain is developing to be on medications, my guess is pediatric patients who are on an SSRI are probably going to need to stay on an SSRI through adulthood, and that, rightly, I think parents have some concerns with. Okay, so that's conventional management, some pros and cons. Now we've got this gap. So we've got cognitive behavioral therapy, which is effective, but it's access limited. It doesn't work for everyone. Parents really need to be involved in this process so they don't accidentally reinforce fears in children. SSRIs, of course, have evidence. They're helpful, but there are real risks. It's not right for every family. It's not right for every child. And this is why I think the unconventional approaches matter. They shouldn't replace first-line care, but they can help us expand the toolkit. And all of these are very, very, very low risk. So let's go through some of these outside the box, but still evidence-based therapies that might be fun and surprising and, I don't know, just interesting. So the first one that I came across was a therapy called laughter yoga. So interesting. I was reviewing studies to put in for my Monday study rundown on pro.naturopathicpediatrics.com, where I do a new piece of research that's relevant to pediatrics every 2 weeks. And I found this study that's in, I believe, a European research journal called Acta Psychologica, and it's a 2026 systematic review of laughter yoga and its effects on mental health, emotional, and cognitive functioning in children. Pretty cool. So what is laughter yoga? Laughter yoga was developed in the 1990s by an Indian physician, Dr. Madan Kataria. I hope I'm pronouncing his name right. He has a lot of really fun and interesting YouTube videos, including a YouTube video of his personal experience of where laughter yoga came from. He's a practicing physician in India. And developed this as a way to just improve mental health outcomes in his patients. It combines intentional or simulated laughter with deep yogic breathing. So he describes it in his video of the history that there was already research about how laughter helps the vagus nerve, it helps improve anxiety levels. And so they started with telling jokes, but they found that they were running out of jokes. And then they kind of turned to dirty jokes or maybe not appropriate jokes, and people didn't appreciate that. And so they started just doing laughter, forcing laughter. And what they found is that the body cannot distinguish between genuine and simulated laughter. The physiologic effects, not the psychological effects, but the actual physiologic effects are basically the same between forced laughter and real laughter. And what they found is that laughter also becomes basically self-reinforcing. It turns into genuine laughter within minutes. If you watch his videos, it's really hard not to smile because he just has this bright personality and kind of laughs throughout his video, which is really fun. The neat part about laughter yoga is that it's great fit for kids. Kids already love to laugh. It's playful, it's social, it's accessible to kids. What they found in some of the mechanisms is that laughter itself increases endorphin releases, which is great. It decreases cortisol and epinephrine. Those are our main stress hormones, of course. It actually directly activates the parasympathetic nervous system. That's our rest and digest nervous system. So it counterbalances our fight or flight response. It helps directly lower that on edge sort of activation. And then when you combine it with the yogic breathing, it increases oxygen intake, which then just does the same thing as all of these. It increases the endorphins, it decreases cortisol. So combining those two is really effective. So what did the evidence show? This 2026 systematic review found meaningful improvements in anxiety, mood, and emotional regulation in children. It noted that there were actually increases in cognitive function as well. So the cognitive benefits included increased attention and executive function, which really makes sense given anxiety's cognitive effects. But there are some researchers and some clinicians that are hypothesizing that executive function deficits in kids and ADHD in kids are mostly related to anxiety. So kids who stay in this heightened stress response all day, if the body cannot relax, if the brain cannot not get into this nice, relaxed brain forms, it's really hard to have good cognitive function. It requires this rested state. I think all of us have experienced this in times of increased stress or like not thinking correctly. So I think that that's really cool that doing an intervention like laughter can actually improve cognitive function as well. There's some practical advantages here. No cost. I mean, it costs, I think, to get trained, but it doesn't cost to do it. You don't need any equipment. You need your lungs and you need a sense of humor. You need to be able to laugh. That maybe that wouldn't work for someone who has no sense of humor, but I think you could force everyone to laugh. You can deliver it in schools, in clinics. There are obviously no side effects. That's really great. And it doesn't actually require cognitive processing. It's not like cognitive behavioral therapy where you need to be able to think through your values, your behaviors. You need to be able to rate things. It just is laughter. So that is a huge advantage for younger kids or for those who resist talk therapy or it's just not effective for. And then families can do it at home together, which is pretty great. Okay, therapy number 2 is called behavioral activation. This was a little bit new for me, or at least sort of heard of this, but not that term before. And our source here it's a 2018 systematic review. So it's a little ways ago. It was in a European Child and Adolescent Psychiatry 2018. It was a systematic review of 19 studies across 21 articles, including 4 randomized controlled trials. I believe there's a newer review, but it included fewer pieces of evidence, so that's not as helpful. Okay, so what is it? Behavioral activation was originally developed as a treatment for depression. The core thought or insight or idea that is based around is that depression in particular is maintained or often maintained by withdrawal from rewarding activities and by excessive avoidance. What it means is like patients become depressed, they withdraw socially, they withdraw from pleasurable activities, which then perpetuates depression, which then perpetuates this withdrawal from rewarding and meaningful activities. What behavioral activation does is it intervenes by breaking that cycle by scheduling meaningful and rewarding activities and not allowing avoidance. So why that matters for anxiety is that anxiety and depression are often similar, of course. They share a core mechanism, and that is avoidance. Behavioral activation targets avoidance directly, and it intervenes by saying, you're not going to avoid, we're going to schedule meaningful activities. So the way that this sort of works is that it tracks activity. So it tracks what patients are doing every day. It deliberately schedules high value activities. So something that could increase pleasure, something that could increase awe. There's a whole other area of research that shows that awe-inspiring activities decrease symptoms of depression and anxiety. And then it helps patients understand what is driving avoidance, and it helps problem solve barriers. So I can already hear criticism of this. I can already hear criticism of someone being like, well, I'm too depressed to do this. And yeah, I get it. So patients who have severe depression are going to super struggle with this. And that is where a therapist comes in, or a parent or a caregiver would come in and say, we're doing this anyways. And just like anyone who's experienced depression or anxiety and said, I'm too depressed to exercise, but once you get to the gym, you feel better. I don't care whether you want to do it or not. Like, we are going to do it. So what the evidence shows, the 4 randomized controlled trials showed a really large effect for at least depression. Anxiety outcomes didn't reach statistical significance, but did show positive trends. The feasibility they found in the study was good. It worked, even though I think most parents and people with depression would think this isn't going to work. But it was quite accepted by kids. Kids were able to engage, and the dropout rates were not that high, which is kind of amazing. And it can be delivered by non-specialists is what they found, which is another pro. Psychology assistants, social workers, school counselors, parents. It didn't require really intensive, really specifically trained therapists, which is really great. And then again, the adaptations that they found here were just parental involvement, so parents facilitating activities and removing barriers to kids participating in activities. They found that when we develop youth-friendly materials or language that's engaging to kids, making it sound fun and exciting, that was helpful. They had some problem-solving tools that were really effective. Making some really concrete and realistic goal setting for kids was really effective. And a school-based delivery method was really effective as well. So again, reasons that it could be pretty promising is it can be delivered outside mental health settings. It does not require a one-on-one trained therapist. It is scalable. It seems to address co-occurring anxiety and depression, which is very common in kids and adults as well. It doesn't require a lot of cognitive function. I mean, it does require some planning, but the planning portion does not have to be completed by the child themselves. I would recommend that we get some feedback from them, like, what are the activities you want to engage with? I want to engage with a Lego club. I don't want to engage with, I don't know, soccer that I hate, or this swim team where the coach is bullying me or something like that. But the parent can really plan it out, and it doesn't require kids to be so highly engaged in like a cognitive behavioral therapy focus. I could imagine this could be really challenging in resource limited areas, in areas where there aren't clubs, there aren't after school activities. If a parent is working, working 40 hours a week and doesn't have the energy or time to put kids, or money to put kids in an after school activity, that could be very challenging. But I could say that there'd be ways that we could address that. Like, we are doing a walk after I get home from work, which would be helpful for most families. We're going to do a library trip a certain number of days of the week. We're going to go to a park on the weekends. Those would be kind of low, like easily achievable benchmarks for a lot of families. But again, I think pretty great. Number 3, exercise. I mean, we all sort of know this, right? But there's a lot of studies here and a lot of specific studies here. So it's something that we should really, really, really think about. A 2025 study from the Scandinavian Journal of Medicine and Science in Sports did a meta-analysis of 22 studies and focused specifically on children and adolescents. Exercise training in general significantly reduced anxiety symptoms. It had a really good clinical meaningful effect here. And they found, as to be expected, that moderate or high intensity exercise is the most significant. Low intensity exercise didn't quite find significant benefits. They really didn't find any other modifiers. So other than intensity of exercise, it didn't really matter the type, the duration, the frequency, the age of the child, male or female, just exercise, high intensity. I have found that to be one of the most clinically meaningful interventions in my practice as well, particularly for kids who are highly anxious and on the spectrum, highly anxious with sensory issues or highly anxious with behavioral problems, specifically oppositional defiant disorder. And why it works. So we know that exercise increases release of endorphins, serotonin, dopamine. It actually increases BDNF, which is brain-derived neurotrophic factor. And that's a chemical that supports neuroplasticity in the brain. So it helps the brain with learning and retention of memory and actually pruning as well. So that's another reason it could help kids who have sensory processing disorders. Exercise also reduces HPA axis overreactivity over time. That's the system that trains the stress response. So we don't want it to become either underactive or overreactive, and it helps regulate that. Exercise also seems to affect the amygdala. The amygdala is our fear center of the brain, and it reduces the amygdala's hyperresponsiveness to threat, which is a central feature of anxiety. Of course, exercise improves sleep quality, and exercise, they found in this large study that it improves self-efficacy, confidence, and sense of mastery, which is so great for children when we want to increase resilience in them and we want them to become independent future adults. Exercise, of course, no pharmaceutical side effects. Kids need to be exercising anyways for cardiovascular fitness, for flexibility, for general health. And then when it's done with peers in like a sports setting, it does add a social connection. Just to tie this back in with ODD, they found that participation in group sports reduces ODD risk later or reduces ODD severity later in teenagehood, because you have to be able to cooperate and you have to be able to listen to a coach. So that's great. And then it builds skills and habits that persist. Kids do not have to be in a group sport, but I do recommend it when appropriate. Some kids are not a good fit for group sports, and they are better in focused, individualized sports like wrestling or martial arts or track or cross country or something like that. Recommendations are moderate to high intensity. If you've got an anxious kid, ship them outside and make them run laps around the block. Put on an exercise video. Do an exercise video as a family. That could be a great intervention. The American Academy of Pediatrics has a strong recommendation of 60 minutes a day of activity for kids. I strongly recommend outdoor activity whenever reasonably appropriate. Number 4, art therapy. I love art personally. I found that art when I was a teen and going through all the feels that all teens and tweens go through was super helpful. There was a 2024 meta-analysis that included 6 randomized controlled trials and 422 participants that found significant reductions in anxiety, really good significant reductions in anxiety. So this could include anything in art therapy. This could be visual media, painting, drawing, sculpting, clay, jewelry making, beading, textile art, like crochet, cross stitching, any of them. They found that it was really process focused, not product focused, that it was the making of the art that mattered, not the result. So anything that kids want to get their hands on, and it could be used as either a standalone or as an adjunct to other treatment. There's, of course, others than visual media. There's music as well, and that's actually another whole realm that's been studied. And this could be a group activity or an individual activity. It didn't really matter. It is important to note that they found one thing really important, and that was that doing it twice a week was much, much more effective than a once weekly event. So that's something to think about as well. And maybe it just takes longer for the brain to calm down if you're doing repeated events than just a once a week event. It not only allows for emotional exploration, but media really needs it. That's the whole point of art, which is great. Some advantages: it's non-pharmacological, it's low risk, it's expensive would be the cons. I mean, you could do anything from a piece of paper and pencil, but if you start getting addicted in art therapy, man, I'll tell you, it gets real expensive real fast. But it also doesn't have to be. A set of watercolors from Crayola is 99 cents when they're on sale for back to school. A couple pieces of paper can be really cheap. I think that that's really great. It doesn't require kids to be verbal. It requires very minimal hand-eye coordination, maybe for younger kids. So that could be challenging for kids under, say, the age of 5, but they could do Play-Doh or clay or something like that. And then again, it could be a family or group activity. The whole family could paint or draw together, and that would be really great. There's really no right or wrong way to do it. I would just recommend for kids who are really anxious, if you're going to do this as a therapy, to try to set aside time at least twice a week, since that's what the study showed was more effective. Therapy number 5, this one is fun. It says forest bathing. There was a study in International Journal of Mental Health Nursing, a systematic review and meta-analysis. So it's called Shinrin Yoku. I hope I'm saying that right, which is Japanese for a term called forest bathing. And forest bathing is immersive, mindful time in a natural forest or a green environment. It's not specifically hiking. It's not specifically exercise. It's not specifically bird watching, just being in a forest. It is supposed to be slow, deliberate, being present, feeling the texture of the earth, feeling bark, smelling the air, looking at the leaves of the tree, hearing the rustle of the wind through the leaves. Engaging all the senses is what's really important for this. They say that the forests engage involuntary or effortless attention versus staring at a screen, which requires a certain type of cognitive focus. So it allows that directed attention to replenish. So basically, I can look anywhere. I can look at this. I can see that. So that reduces the cognitive fatigue. It helps replenish our attentional memory. They also think that some of the chemicals released by trees directly cause improvements in immune system function and stress hormones. And then there's this idea that just unstructured outdoor time in general changes the way that the brain processes. So it improves attention, creativity. It helps with emotional regulation when there's this unstructured time. It improves resilience in kids. And there is some thought, again, not there's no concrete evidence because it's hard to study, but they think that the reduction in unstructured time is actually contributing to pediatric anxiety and ADHD rates in kids. When parents come to see me for ADHD for kids, and I do a lot of ADHD treatment, one of the questions I will ask is, what's their behavior like when they're outdoors in nature? And And I think it's maybe 100% of the time. I was going to say 99% of the time, but I cannot think of a time a parent has said it's not better. And my response to that is, is it a problem with the child then? Or is it a problem with their environment? Children are little natural beings. They feel deeply. They are sensitive to changes in nature. And the more time that we can get them outside, the better. Some practical thoughts on this one is with forest bathing in particular, they recommended an actual green space with trees, not just an urban park. But you know what? Do whatever you need to do. You get to this close of the place that has a tree or grass or anything. They also recommended regular exposure, not just occasional trips. Again, that's easier said than done in certain environments. And then if you can stack it with exercise, either before or after or during, then that can help bring two things together at the same time. Zero cost, unless you're paying for a parking ticket or a parks pass. But I recommend finding whatever you have that's near you, even if it's a pea patch, a neighborhood pea patch that you can go visit, or again, a local park or a conservation garden, anything like that could be really helpful. And then number 6, music. Music, humming, singing, and the vagus nerve. There was a 2018 meta-analysis of 5 studies in children and adolescents specifically, and it did show significant reduction in anxiety and depression symptoms compared to controls. There's only 5 studies, there wasn't the great methods in this, but it did show response and it was specific to pediatrics. There was a study in humming and breath work. So there's a study on yogic humming breath work that significantly increases heart rate variability, which by the way, heart rate variability when it goes up, is a marker of reduced stress response. And it showed that this yogic humming, compared to just a slow-paced breathing, is really significantly improves heart rate variability. So what the studies were showing was that humming produces this extended exhalation at 0.1 hertz, which is the same frequency of the cardiovascular system, which is cool. And it's the same mechanism as heart rate variability biofeedback, which is cool. So basically, you can do humming instead of biofeedback as a way to achieve this slow-paced breathing at this resonance frequency that directly affects the nervous system response. Great, because you can hum anywhere. Unfortunately, kids can hum everywhere and drive the parents crazy. So that could be one that might need some limitations. Otherwise, you just have a kid buzzing in your ear all day, and I could see that that could increase anxiety in the home. But as a family, you could do a humming exercise for a few minutes. And then the vagus nerve connection. So that's how all of this is combined. There's no study here, but this is what the mechanism is discussing. So the vagus nerve is the primary nerve of the parasympathetic nervous system. Again, our relax and digest nervous system. It connects the brain to the body. So physiologically connects that. Vagal tone is inversely correlated with anxiety. So low vagal tone means patients have more sympathetic nervous system response. So they're more sympathetic dominant. They're more stressed, basically. They're more reactive. They're more anxious. So the more we can increase our vagal tone or improve that, the more we reduce our anxiety. We can do it by either singing or humming just by prolonging exhalation. So when you sing, you have to hold your breath and, slowly let that out. Similarly with humming, it actually increases vagal tone is what they've found. There are vagus nerve stimulator devices that are used for treatment-resistant depression and epilepsy in adults. I've found it very challenging to almost impossible to get insurance to cover them, and they're usually several $100s. Interestingly, what I've heard is a cat purring is similar in frequency. So a cat purring on the chest or the neck could be really nice. Okay, so those were the 6 interventions. Man, there's so much more to say, and I could go on and on and on and on and on. And then this would be a 80-part podcast episode, which maybe no one would have time for. The TLDR here, the summary, the takeaway. Multiple mechanisms are overlapping here. Vagus nerve stimulation is in a lot of these, improving heart rate variability, improving cardiovascular tone, reducing avoidance behaviors for kids, improving the autonomic nervous system, improving positive engagement, increasing self-efficacy and independence for kids. All of these are tied together, and you don't have to do one alone. You could add cognitive behavioral therapy and forest bathing. You could even combine an SSRI with choir. All of these could be added together All of these that I mentioned today are extremely low risk. And for parents, I would just recommend, as you've listened to this podcast episode, if one or two of these interventions really jump out to you and you're like, this is my kid, that's what I recommend to start with. Because the best intervention is the intervention that you can do and that you want to do as a family or for the child in general. Consistency in general is better than perfection. We covered so much, and there's so many more fun things to say in terms of anxiety therapies for kids. I didn't even touch on herbal medicine, which is an absolute love and passion of mine. And I would love to go over those in another podcast episode. If you guys have questions about any of these interventions, comments, something that you've tried as a family that you've found really effective, or even tips of things that you found really effective in your family, I would love to hear your thoughts in the comments section below. As a reminder for all the listeners, please check the show notes for citations. I'll include links as well if I have enough room. And I hope to see you guys next time on the Naturopathic Pediatrics podcast.